A very good morning, my dear friends. In continuation in the series of pediatric dental education, we have already covered the definition of pedodontics and preventive dentistry. We have discussed in details the aims and objectives. And now, in today's discussion, we're going to talk about the responsibilities of a pedodontics towards himself, the community, and towards his patients. And we're going to discuss in detail the scope of pedodontics. So now, friends, we're going to talk about the responsibilities of a periodontist. Now, the three main groups of responsibilities or objectives of the periodontist are as follows. We have divided into three particular heads. One is responsibility towards the patient. What is his responsibility towards the patient? Then responsibility towards the community as a whole. It just can't be the patient, but the community. And finally, responsibility towards himself or herself. Now, these are very important points that we need to consider. One is the health of a child as a pediatrician, and more specifically, we are also concerned with oral health. Okay, health of a child as a whole. Why I'm mentioning is that the mouth is the mirror of the full body. So if we find any systemic ailment which is there, which the patient is not aware, and because of our examination we have come to know about it, it becomes our prime duty to explain this to the parent and refer him to the concerned specialist. Then early diagnosis and prompt treatment. Okay, we cannot postpone the treatment for too long. You have to explain the need for the treatment, and finally, restoring the mouth to good health. Function has to be restored, and to observe and control the necessary developing dentition of the child patient. Relief of pain is our prime concern. Now, many times we have observed, okay, the moment you relieve the pain, the patient disappears, and then he will reappear when the pain reappears. Okay, that is there. Because see, what happens in many times, there is so much fear about the health professionals that till the last moment they will not come to see. Now, I'll give a very simple example. Now, if a child is having a toothache, his tooth is pain. So, what will the mother or the parent do? They first will give basic painkillers and manage. So, the pain is taken care of. Next time the pain happens again, then the pain is a little severe. Okay, then they may again give some medication, or they will have a word with one or two of their friends or neighbors. Okay, what do you do if the child is having pain? So they will say, take this medicine, it's very good, and they will take it. Then they reach the third stage. Now the pain is becoming little more. Okay, the child is unable to eat properly, talk properly, and maybe he's missed a day of school also. Then they come into the second stage. They will visit a pharmacy shop, wherever they are going in their neighborhood. Then the pharmacist says, take this medicine. This is best for the child. This is best for toothache. That's the second stage. Now, third stage, what happens? The child is unable to eat anything, drink anything. There is a big swelling, and 2, 3 nights say the child is awake and the parent is also awake, plus school holidays. That's the time they will visit the dentist. Sometimes we are not wanted. They have to, and when they have no option, that's the time when many patients and their parents visit the dentist. So this is the situation. So relief of pain is our priority, and increase the knowledge. And finally, instill a positive attitude and behavior, because we want the patient to have, a very positive attitude towards dentistry and his oral health, because then only what happens, whatever work you have done, the maintenance remains, and restore the lost tooth structure. And finally, management of special patients. So now we have, again, in short, I will discuss what is the responsibility of the duty of the periodontist towards the patient. One is good judgment while planning and executing an accurate treatment. Okay, whatever is essential, the treatment is based on priority. The first priority, second priority, third priority. The priority would become the chief complaint. That's the reason he is there, and then the other factor also. Okay, then treatment should be performed to the best of his ability. Say, for example, if he is unable to do any procedure, then in such a situations, what he should do, he should refer to the concerned specialist. Okay, suppose I'm not doing the surgical aspects, I'm not doing, oral, some surgical, basic, even dental surgical work, little complicated side, if I'm not doing. So it is better that you call the concerned specialist. And then fees charged should be just. Okay, because many a times in adults you might have one tooth. Okay, but in kids, what happens? Sometimes they come with 14 teeth which are involved. Sometimes the full mouth is involved. So many a times, along with the apprehension along with the apprehension of the parents towards him that the child may not be able to bear so much treatment, the child is not cooperative towards the treatment, cost also becomes a factor. Because say one filling, if it is costing 1 rupee, when there is a question of 20 fillings, then it will be 20 rupees. So chances are the parent can't afford. So the fees also has to be just and fair, and fees should be such that it can accommodate, because there is no point in just one tooth and letting the child go, because you do that tooth and the remaining is that after 3 4 months they will come back again the cycle of pain, discomfort and all that. So your attempt should be to do maximum treatment for the child, and the charges should be very fair and just. I don't say charge less or charge more. Charge in a manner that the patient is able to complete the full mouth rehabilitation. Because children don't come with one tooth. Most of the time it is multiple things. So charges have to be planned accordingly and must be able to handle the children well. Of course, that is what is being taught. Behavior management is an integral part in the teaching of pediatric dentistry. Okay, prevention also must be the main aim, because see, the preventive treatments are very simple. The preventive protocols are very simple. So there should be always stress and a lot of effort should be there from the side of the periodontist so that these are implemented well, and must convey the value of good dentistry and that good dentistry for children is an investment in future. Okay, it is an investment. Everything related to the child, if prevention and everything is done well, it will help him in the future. Now, what is the this is the responsibility of the periodontist towards the patient. Now, the second comes, what is the responsibility towards his nation or his city, for example, or his surroundings, to lead the community programs to promote dental health in children and instill positive value. They should conduct a lot of checkup camps, preventive dental treatment camps. Okay, there should be a lot of health talks happening. Okay, awareness, create an awareness, and it is your job as a periodontist or as a child specialist. You are the best judge for the child's dental health. So remove a lot of time to convey these kind of informative talks also. And as I mentioned, conduct preventive programs and play the role of an educator. Okay, you know, abroad I have observed they have a lot of these preventive programs, and in India also these programs have now been started. So we should be in forefront. Okay, we as periodontists should be in forefront of educating the child, educating parents, and we should try to reach each and every sector of the society. And now, thanks to mobile, internet, and social media, conveying these messages is very, very simple. Okay, so our effort should be educating, conducting a lot of camps, and promoting oral hygiene practices, good oral hygiene and simple oral hygiene practices, and whatever products are available should be brought to the notice of the parents and people as a whole. And finally, towards oneself, we should be proud of his profession, because see, treating children is a big, big privilege which we get. Okay, because children are the purest form of humanity. They're the purest form. So we have an opportunity as a pediatric dentist to treat them. So that's a very, very proud thing for us. And to able to realize that with increased ability comes increased responsibility. So people will look up to us. So we should work very responsibly. All our comments, statements should be very, very conducive. And finally, continual improvement in knowledge and practice with changing trends in dentistry. And finally, honest and render the finest service which he is capable of. Honesty is the best policy, because what happens many times, the parents are willing to do anything for their child. So we should be very honest and sincere when we are proposing various formats of treatment and care. And finally, refer to the patients to other experienced professionals for the betterment of the patients whenever needed. Because see, many a times, certain procedures I may not be doing. So it is mandatory for me to refer to the concerned specialist, because the referral for the betterment of the patient, for the betterment of the dental health of the patient is very, very critical. So friends, this is the basic responsibility of a pediatric dentist. So, and the next part, what we're going to cover today itself is the scope of pedodontics. So many people ask, now milk teeth are there. What will we do about milk teeth? Is there any scope in that? Okay, and plus it is so difficult to do treatment in the children. Will the parents pays? Will the how will I manage? Okay, because adult dentistry is paying, implants is there, endodontics is there, cosmetic dentistry is there, and children said how to manage all that. The cosmetic dentists are making so much, revenue is coming to them, and people are opting for cosmetic treatments. And here we are talking about children. So, is there a scope? So now my basic explanation for their friends, there is a lot of scope in pedodontics. First is pedodontics is an age-specific specialty and not a technique or a disease specific. Okay, it's an age-defined specialty and it is not a special technique or disease-specific specialty. And secondly, it encompasses all aspects of oral health care of children and adolescents and special children with physical or emotional handicap. So right from birth till adolescence plus all special comes in your scope. Finally, preventive measures is in early childhood makes it possible to preserve sound tooth and maintain oral health. And pedodontists also holds the privilege of being the first person to diagnose the earliest signs of any systemic disorder which are manifested more frequently in children's oral cavity as compared to adults. He's the first one to see it. So now I've prepared this small chart. So what all comes in that bracket? What all you as a pedodontist will be responsible for? So this circle or this oval shaped diagram tells us the scope. What all comes as a pedodontist? What all can you do? Okay, because see, now otherwise in dentistry there are 9 specialties. Pedodontics is the 9th one. You have oral medicine where it is all related to diagnosis, radiographs, and all that. Then you have oral pathology, which takes care of the pathological components. Then you have endodontics and conservative dentistry, where it is related to all the restorations, filling, root canals, and related procedures. Then you have prosthodontics, which deals with teeth replacements, fixed, complete dentures, removable dentures, fixed prostheses, implants, all comes in that. Then you have periodontics, all gum related. Okay. Then you have orthodontics, where it's all orthodontic aspects are covered. Okay. Now in periodontics, what all is included? What is there? Is there any scope? So we will start with one basic thing. Oral medicine and radiology. When a child comes to the clinic, especially in a college setup, the X-ray is not made, the radiograph is not made in the oral medicine department. It is made in the pedo department only. So all the radiology and diagnosis, all medicines come in pedodontics. Then restorative dentistry. It is also a part, all kind of different kinds of restorations is a part of pedodontics. Okay, so if you are interested in endodontics, yes sir, I want to do become a root canal specialist. Are in pedo you do root canals also, you do restorations also. Okay, then immunology, that is a small specialty. Neonatology, also you can be called. Child psychology, you have great interest in psychology. Psychology is a major component, behavior management and various techniques, and child psychology is a major part, and it comes in the scope of periodontics. Now, preventive and interceptive orthodontics is also a part of periodontics, and endodontics, so I covered. Then periodontics, all disorders, gingival and periodontal diseases related to children are done in periodontics only. Then you have allied health sciences, okay, various other medical science like pediatricians work. Okay, you are treating a child. So for adult, there is a general adult dentist. For kids, it's kids dentist. Okay, then you have special care dentistry. You want to take care of special children. So you as a pediodontist are well trained for that. And that can be your forte. You can start as practicing that I only handle special kids. As an adult dentist, you can't do that. Okay, you can't do that. Then you have material science. So many new materials are coming in. So many, right from stem cells onward. So much materials come. So when it comes to dental materials in children, variety of materials are required. Okay, with varied kind of properties. So that also comes in pedodontics, part of the scope of it. Then oral rehabilitation, full mouth oral care in child, right from denture, removable dentures, and now even implants. Pediatric implants also are happening. I mean, the time is not far away where, it will be a very, very common practice. Then surgical work. Now you say, oh, I wanted to be an oral surgeon, sir. Now, see, here I am in pedodontics. What will I do as a pedodontics? Because oral surgery is an integral part. Now, your focus area, you are working on children. So, all oral surgical aspects related to children you can focus on, right from cleft lip, cleft palate. Who's telling you no? Right from cyst, impacted the supernumerary, a variety of pediatric trauma. It comes, so if your interest is oral surgery and for some reason you are unable to get post graduation in oral surgery, you can focus on pediatric oral surgery. Okay, that will be your area of work. Preventive dentistry too is there. The basics of period. That's why periodontics, the branch itself is called as periodontics and preventive dentistry. Cariology, dental caries, periodontic. I mean, you want to do a lot of research in caries. So we have, you have scope to study the decidual caries in deciduous dentition, caries in mixed dentition, and finally in the permanent dentition. So this is the basic scope of periodontics and preventive dentistry. So at this particular juncture, of course, and lasers also is a part. Lasers also is a part of periodontics and preventive dentistry. Lasers can be used. Anything new has its place in periodontics and preventive dentistry. When you join your post graduation, when you take up pediatric dentistry, the scope is endless. Anything and everything related to the child you can perform. Thank you so much for your precious time.